Welcome back this morning. September serves as Suicide Awareness Month.
That's right, and now Dr. Kyle Berkey joins us live this morning to tell us why it's so important to observe this month. Good morning.
Good morning. Thanks for having me.
Glad to have you on.
Absolutely. So to start things off, why is National Suicide Awareness Month important for those of us in the general public who aren't in the behavioral health field?
Yeah, unfortunately, there's still a stigma surrounding mental health and specifically surrounding suicide. And so that's why National Suicide Prevention Month is so important. In the state of Illinois, we have on average 1,500 deaths by suicide each year. That's about 4 residents per day. And in fact, there's only 9 states in the rest of the country that have a higher number of suicide per year than we do. And as a pediatric provider, I think the most important thing to me is the impact this is having on our younger generation. Suicide is the 3rd leading cause of death among our young adults aged 15 to 34.
All right, well, obviously we want to talk about the warning signs. What are these that people should be on the lookout for?
Yeah, I like to talk about identification warning signs and what can we listen for and what can we watch for. When it comes to listening, we want to listen for individuals who are struggling with suicidal ideation. They may talk about suicide or different ways that they can die. They may talk about being a burden to others or feeling as though other people would be better if they weren't around. And maybe one of the biggest things to look for is listen for those individuals who are saying goodbye to others in a way that's not like goodbye for now, but they're saying goodbye that they think they're not going to see that person ever again. Now, the things that we can watch for, we want to watch for somebody who seems emotionally numb or persistently sad. We also want to look for changes in activities of daily living. So somebody who's had a significant change in sleep, whether it's more or less, eating more or less, a significant increase in substance use or alcohol use. And I think the 2 biggest ones are somebody who's giving away belongings, especially if it's those prized possessions that they have. That's a big warning sign. And then anybody taking actions towards acquiring somehow that they could end their life. So saving up money to purchase a gun or stockpiling pills, those are big warning signs we want to watch for.
You know, some people may find it difficult or be uncomfortable to talk about suicide. Do you have any recommendations, advice, thoughts for people who may feel this way?
Yeah, I think there's a big misconception that talking or asking about suicide or even using the word suicide may somehow put an idea in somebody's head, and that's just not true. We have a lot of evidence, a lot of research that supports being direct and asking those direct questions is actually one of the best things that we can do. At OSF, we use what's called the Columbia Suicide Severity Rating Scale. It's an evidence-based tool that is historically for professionals, but it's recently been released for the general public, which is absolutely incredible that we now have an evidence-based screening tool in the hands of every American that's there. If it's okay, I'm going to go ahead and actually read through the 6 questions of the screener because I think it's really important that people are aware of those, and I don't want to get them wrong, so I brought the paper with me. So question 1, have you wished you were dead or wished you could go to sleep and not wake up? Number 2, have you actually had thoughts about killing yourself? Number 3, have you thought about how you might do it? Number 4, have you had any intention of acting on these thoughts of killing yourself? Number 5, have you started to work out or actually worked out the details of how to kill yourself, and do you intend to do this? And number 6, have you done anything, started to do anything, or prepared to do anything that would end your life? And if we have a yes response to 4, 5, or 6, that's a statistical predictor that this person is at high risk for suicide, and we need to get emergency mental health assistance to that person instantly. Okay. If you are a person who asks those questions or somebody tells you that, we need to call 911, stay with that individual, and get them help immediately.
All right, well, Dr. Berkey, thanks so much for joining us this morning. We want to make sure we get all that info on our website, so thanks so much for all that very important information.